therapist is you might assume that something is a problem when it's really not.
I love the series that Dr. Katelyn is doing, and it even got me thinking about how that might be specifically interesting when working with kids and parents, where they might have different presenting concerns and how to balance that. And I do not have a perfect answer. So if you do, please drop it below. But when working with kids and families, we think about who is the patient, which as a pediatric psychologist, my patient is the child. And we try to maintain as much confidentiality as we can, but there are certain things we have to report to the parent or to like CPS if things involve abuse or neglect or things like that. And it is so tricky when the parent might say that the concerns are oppositional or defiant behaviors, and then you meet with a kid and it's like, you're just really depressed, and kind of how to balance both perspectives, because usually the child can't come if the parent isn't on board, right? So we do have to maintain that caregiver buy-in, even if we might not agree with what they describe as the main problem, because we need the parent to keep bringing the child and or participating in treatment. We don't live in a vacuum, so we do need to involve the whole system most often to make positive change, although it's not always possible. So I think a good therapy skill is learning how to balance the parents presenting concern, the child's reported presenting concern, and then maybe like what you think is kind of going on, and how to maintain a rapport with all members so that it can be more productive. Because if the child feels alienated or the parent does, most likely we won't see too much progress.